Hello, my name is Miranda McNurlen, and I am presenting on the effects of caffeine on blood pressure. So I will talk about what exactly is caffeine, how it affects the body specifically, what products contain caffeine and how to find the amounts of caffeine on a certain product, what blood pressure is, what normal blood pressure is, and what fluctuations a person can have in blood pressure. And then I will go into quite a few studies on the effects of caffeine on blood pressure. So what is caffeine? It is a plant byproduct found in a wide variety of things. It is in coffee beans, tea, soft drinks, cocoa, and then even some medications, some over-the-counter, some prescription. This is a slide that just shows some of the products that caffeine isn't found in, like chocolate. I don't think many people think about chocolate having caffeine in it, or soft candies, even baked goods. Energy drinks obviously contain caffeine, coffee products, and you can find the amount of caffeine in the nutrition label. It should tell you in milligrams how much caffeine is in that product. So what does caffeine do? It acts on the central nervous system. It binds to receptor sites, and it helps you feel more alert. It helps you wake up, feel less sleepy throughout the day, kind of gives you a jolt of energy. And that is the main purpose of caffeine. So the effects can begin within 15 minutes of ingestion with moderation, which the recommended amount is 200 milligrams or less per day of caffeine. This can decrease side effects that you may experience and decrease dependence on caffeine as well. Another interesting thing about caffeine is that there is a misconception or sort of theory or old wives' tale that caffeine, coffee specifically, will cure your hangover or increase sobriety when you have been drinking alcohol. And that is completely false. It does not have anything to do with decreasing the hangover or decreasing the amount of alcohol in your system. It simply gives you an energy boost, and I think that's what people conceive as curing their hangover. So here is a short video that explains more in depth the effects of caffeine on the central nervous system.
Caffeine is a stimulant drug and the most widely consumed mind-altering substance in the world. It belongs to a class of compounds known as the methylxanthines and is commonly found in a number of natural sources, including the seeds of coffee plants and the leaves of tea plants. Most of the effects of caffeine are thought to be traceable back to its action as an antagonist at receptors for a neurotransmitter called adenosine. This means that caffeine binds to adenosine receptors and blocks adenosine from binding there and activating the receptor. Thus, it reduces activity at the adenosine receptor. Although there are 4 subtypes of the adenosine receptor, most of caffeine's effects are thought to be due to its antagonistic actions at the A1 and A2A subtypes. Its ability to promote wakefulness may be especially due to actions at the A2A receptor subtype. How exactly the antagonism of the adenosine receptor translates into the effects of caffeine is not completely clear. Research suggests, however, that adenosine receptors are involved in promoting and regulating sleep. One way this is thought to occur is that adenosine activity can prompt the release of the neurotransmitter GABA, which then inhibits neurons involved in arousal and wakefulness. This promotes sleep, but when caffeine antagonizes adenosine receptors, it opposes this action and causes arousal. Adenosine receptors are also thought to be involved in reducing the activity of a number of neurotransmitters, including dopamine and norepinephrine, through methods ranging from inhibiting neurotransmitter release to affecting neurotransmitter binding. Thus, caffeine also blocks these effects, which may contribute to caffeine's stimulating and reinforcing actions.
Okay, so that just tells you a little bit more about what exactly the caffeine is doing to your central nervous system. And this slide shows how much caffeine is actually in some drinks that are commonly consumed. The first being brewed coffee, and a single 6-ounce cup of caffeinated coffee can contain 95 to 200 milligrams of caffeine. So again, it's important to look at how much caffeine is in each specific product. Different things, different types of coffee can have different amounts of caffeine. Different, like espresso 2 versus coffee has different caffeine levels. Some other drinks, such as Coca-Cola, that has 40 milligrams of caffeine. Red Bull has 80 milligrams, and then decaf coffee, a 6-ounce cup of decaf coffee has 3 milligrams of caffeine. I think, for me at least, it seems that everyone around me drinks some amount of caffeine, whether it's from soda, coffee, tea. It's just a huge part of society, especially I think in healthcare, when you're working 12-hour shifts in a nursing school, when you're studying constantly and preparing and going to school and working and all these things, you sort of develop a dependency on coffee. At least I have, especially in nursing school. So some of the side effects are jitteriness, anxiety, frequent urination, and that's related to the diuretic property of caffeine, and I'll talk about that a little bit later. It can increase your heart rate. It can cause nausea, especially if you drink coffee on an empty stomach. It can cause a headache. All of these things. And it's also talked about having an impact on blood pressure, high and low. So we'll discuss that later. But those are a lot of the significant side effects. And it depends hugely on how much caffeine you're ingesting. So a mild consumption of 500 milligrams per day can be seen in just slightly increased heart rate, some jitteriness, a little bit of anxiety, whereas long-term effects can be seen with a consumption of more than 1,000 milligrams per day. And that, when you hit that mark of 1,000 milligrams per day, that's when physical dependence sort of sets in, and withdrawal can occur when you take away that caffeine. So blood pressure. In nursing school, we know all about blood pressure, but I think it's important just to go over the basics of it. Blood pressure is a measurement of the fluid in the intravascular system, which is your blood. So it's measuring the pressure systolically and diastolically. Systole is a measurement of the pressure exerted when blood is ejected into the arteries from the heart. And then diastole, or the diastolic blood pressure, is the measurement of the pressure that blood exerts within the arteries between each heartbeat. Fluctuations in blood pressure, we can have hypo or hypertension, hypo being low, hyper being high, obviously. And alterations in blood pressure can be chronic, or they can be mild and short-lasting, depending on various activities, such as consuming tons of fluid or being dehydrated, position changes. Orthostatic blood pressure is a big thing that we pay attention to in nursing. Genetics has a role in blood pressure as well. Medications, we know we can have antihypertensive medications. We can also have medications that higher blood pressure. And then diet as well. So let's talk about the link between caffeine and blood pressure. So we'll go over a few different studies. There are some controversy around the effects of caffeine on blood pressure. I always thought that it created high blood pressure, no matter what. It always did, and that was the end of it. It didn't have any alteration from that. It just sort of made sense in my head, and I think for a lot of people it does, that it just, with that anxiety and jitteriness and increased heart rate, it just brings up your blood pressure as well. The first was an Italian study done in 1987, and the significance of this one is that around this time, especially America, but also other places around the world, blood pressure and heart disease were becoming a big issue. We were just starting to see more obesity and comorbidities with high blood pressure. So I think that's when caffeine really started to be looked at as a factor in blood pressure. So the study in Italy was done on 500 participants, ages 18 to 62, and they did adjust their blood pressure findings based on age, sex, and habits such as smoking, alcohol consumption, and activity, as well as a history, if they had a history of high blood pressure. So they looked at non-coffee drinkers and coffee drinkers, habitual coffee drinkers, and it was actually really interesting. This was the first study that I found that found a correlation between caffeine and low blood pressure. So what they found was a significant blood pressure decrease with increasing coffee consumption. So they saw a negative 1.8, a mean negative 1.8 decrease in systolic blood pressure and a negative 1.1 decrease in diastolic blood pressure. And then from there, they looked at how many cups of coffee the coffee drinkers were drinking and correlated their blood pressures for that. And overall, the mean reduction in systolic and diastolic blood pressure was 0.8 millimeters per mercury for systolic and 0.48 for diastolic per cup per day. So I thought that was pretty interesting. The next study I looked at was a collaborative study between Switzerland and the US, and it was a follow-up of the Italian study. So they looked at only 15 volunteers. 6 were habitual coffee drinkers and the others drank coffee on occasion. All of the participants had no history of hypertension, smoking, or a family history of hypertension, so that was really important to note. And they were overall really healthy individuals. So what they did is monitor heart rate, blood pressure, and the sympathetic nervous system. They used 4 conditions, the first being regular triple espresso intake before and after of all of these. Before and after decaffeinated triple espresso, before and after IV caffeine injection of 250 milligrams, and then before and after of an IV placebo injection, which was normal saline. And with all of these, between all of the conditions, they found that almost all of their participants experienced a decrease in blood pressure. The correlation was sort of confusing to look at, but not all of them experienced a rise in blood pressure initially, but some experienced an initial rise, and then their overall BP dropped significantly from their baseline. So the biggest correlation they saw was with the pure caffeine injection. They expected to see a huge increase in blood pressure, whereas they saw more of a decrease in the blood pressure than with the other products. And they attributed that to the lack of other additives in the caffeine injection. With an espresso, there may be some sugar, there may be other things added, some milk, different ingredients. And with the caffeine injection, it was pure caffeine. The next study was done on the effects of tea and blood pressure. They used black and green tea for the study, and they looked at a total of it was a meta-analysis, so they looked at many other studies. They looked at a total of 25 studies consisting of 1,476 subjects. So that's huge. That's a lot of information that they took in, and they determined, based off all of this, that acute intake of caffeine in tea had no effect on blood pressure, and then chronic and long-term intake of the tea decreased blood pressure. And green tea had the greatest effect. And they described long-term intake as greater than 12 weeks. So that is pretty significant. They also, in this study, concluded that with the decrease in blood pressure, there was a huge correlation between decreased incidence of stroke and cardiovascular disease. There was actually an 8% reduction in stroke risk and a 5% decrease in coronary artery disease associated mortality. Energy drinks. This was the next study I looked at. A standard energy drink contains about 80 milligrams of caffeine. It also contains a lot of other ingredients that are important to remember, like glucose and taurine. The study looked at 68 volunteers in two groups. The first half of the volunteers consumed 3 energy drinks at 1-hour intervals for a total of 240 milligrams of caffeine, and the second group consumed water in the same amounts. And it was found that the caffeine group had significant diastolic blood pressure decrease, which was over 8% from their baseline. And there was no significant change in systolic blood pressure or heart rate. There were changes in blood glucose, obviously, but that I didn't look at that as much for this, for the purposes of this presentation. The last study that I looked at was habitual coffee drinkers. It examined the correlation between consuming caffeine habitually and blood pressure. It utilized over 3,000 male subjects for this study, and it utilized self-administered questionnaires. So the participants were self-reporting on their caffeine consumption, which could skew slightly, but I think with this amount of subjects, it's a pretty good sample size. So blood pressure was analyzed accounting for habits such as alcohol use, smoking, the person's BMI, glucose tolerance, and other caffeinated drink intake. So that's important too. Just accounting for all of those things those can cause alterations as well. So accounting for those is a big thing. And there's a significant inverse relationship found between the coffee intake and blood pressure. The relationship found was a difference of 0.4 millimeters per mercury decrease in diastolic blood pressure and 0.6 millimeters per mercury of systolic blood pressure per cup of coffee per day. And that correlates with a previous study that I talked about earlier. So what does this all mean? There have been a huge variety of studies done, and many point to a blood pressure decrease with caffeine, which is contrary to what I believed. And I think from what I found, all of the reputable peer-reviewed sources were consistent with the blood pressure decrease, whereas there is a lot of non-reputable sources that reported a increase in blood pressure with caffeine consumption. So I think it's important, really important, to know all this. These effects, or the decrease in blood pressure was typically associated with the diuresis, or the diuretic effect of the caffeine. So basically just a decreased fluid balance. Dehydration was the big thing. You're consuming all of this coffee and you're urinating all of the fluid out, so your blood pressure is going to drop over time, and chronically, per se, with habitual coffee drinking. So it's just, that was the big thing, is that it does decrease blood pressure, but that's attributed to the diuretic effect. So, in summary, caffeine is found in a variety of products, and it affects the central nervous system. We know that there are varying amounts of caffeine in different products, so knowing how to find that caffeine amount is really important. And knowing how much caffeine you're consuming affects your body. And then understanding how blood pressure works as well, and what different alterations can happen with different lifestyle changes. With all of the research that I did for this, it was pretty unanimous that caffeine decreases blood pressure, and therefore decreases comorbidities such as cardiovascular disease and stroke. So although it's dehydrating you, it's decreasing some other really serious body systems and alterations in body systems. And then with that, understanding how you can help patients, I think, is really important since we're in nursing school. Describing to patients how to find caffeine amounts, teaching moderation, and teaching rehydration as well. That when you drink a cup of coffee, also drink a glass of water. That's really important since it is dehydrating you. I want to thank you for listening. If you have any questions on the topic, I'm happy to answer them. And here are my references.